to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at New Webinars, and YouTube at tinyurl.com/newwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM live stream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila. The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/newwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at MU Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022, and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MuWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at MU Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM live stream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. Good morning to everyone. Welcome to today's forum. The forum will start in 15 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MuWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at New Webinars, and YouTube at tinyurl.com/newwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and/or last Tuesday of the month from July 2021 to June 2022, and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/newwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, Please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at MU Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. The forum will start in 5 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022, and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MuWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at MU Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Orasyo Imperata para sa proteksyon laban sa COVID-19 virus. Mahabagin at mapagmahal na Ama, nagsusumamo kami sa iyo upang hilingin ang iyong patnubay laban sa COVID-19 na nagpapahirap sa marami at kumitil na ng mga buhay. Tunghayan mo kami ng may pagmamahal at ipagadya kami ng inyong mapaghilom na kamay mula sa takot sa kamatayan at karamdaman. Itaguyod mo kami sa pag-asa at patatagin sa pananampalataya. Gabayan mo ang mga dalubhasang naatasan na tumuklas na mga lunas at paraan upang ihinto ang paglaganap nito. Nagpapasalamat kami sa mga bakunang naisulong sa patnubay ng iyong mga kamay. Pagpalain mo ang aming mga pagsisikap na mawakasan ng mga bakuna ang pandemya sa aming bayan. Patnubayan mo ang mga lumilingap sa may sakit upang ang kanilang paggalinga ay malaki pa ng husay at malasakit. Pagkalooban mo sila ng kalusugan sa isip at katawan, katatagan sa kanilang paninindigang maglingkod at ipagsanggalang sa karamdaman. Itinataas namin ng mga nagdurusa. Makamtan nawa nila ang mabuting kalusugan. Lingapin mo rin ang mga kumakalinga sa kanila. Pagkamitin mo ng kapayapaang walang hanggan ang mga pumanaw na. Pagkalooban mo kami ng biyaya na magtulong-tulong tungo sa ikabubuti ng lahat. Pukawin sa amin ang pagmamalasakit sa mga nangangailangan. Sa pagdamay at malasakit namin sa bawat isa, malampasan nawa namin ang krisis na ito at lumago sa kabanalan at pagbabalik loob sa iyo. Hinihiling namin ito sa pamamagitan ni Hesukristo na nabubuhay at naghaharing kasama mo at ng Espiritu Santo, Diyos magpasawalang hanggan. Amen. Dumudulog kami sa iyong patnubay, mahal na ina ng Diyos. Pakinggan mo ang aming mga kahilingan sa aming pangangailangan at ipag-adya mo kami sa lahat ng kasamaan, maluwalhati at pinagbalang Birhen. Amen. Mahal na Birhen, mapagpagaling sa may sakit, ipanalangin mo kami. San Jose, ipanalangin mo kami. San Rafael Arcangel, ipanalangin mo kami. San Roque, ipanalangin mo kami. San Lorenzo Ruiz, ipanalangin mo kami. San Pedro Calungsod, ipanalangin mo kami.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM live stream. The title of this forum is She Can and She Will, a Women Empowerment Webinar, or KKK, Kayang-Kaya ng Kababaihan. Today's forum aims to give us insights on women empowerment and the role of women in the society. For today's forum, we have Dr. Jean-Ann Toral, a gynecologic oncologist, a professor of the Division of Gynecologic Oncology, Department of Obstetrics and Gynecology of the University of the Philippines College of Medicine, and a medical specialist 3 and coordinator for research of the Philippine General Hospital as our moderator.
Okay, thank you very much. Good afternoon, everyone, and welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. And we are on our 12th leg today, and it's International Women's Day. And what a fitting way for the sorority to celebrate this day with this Women Empowerment webinar. And we have for this afternoon very distinguished and empowered women as our speakers and Reactor. We have Dr. Carmencita Padilla and Dr. Filomena T. Santiago-San Juan. So let me call on our first speaker. Our first speaker is esteemed alumna of the UP College of Medicine, class 1978. She belongs to the Department of Obstetrics and Gynecology of the UP College of Medicine, Philippine General Hospital, and I'm a proud student of Doktora San Juan. She has 3 subspecialties. She's a gynecologic oncologist, she's a trophoblastic disease specialist, and an OBGYN sonologist. She's probably one of, the only one with those 3 subspecialties. And she actually pioneered the OBGYN ultrasound program in the country back in 1996, and it has flourished so much in the past more than 25 years. And she's a leader She's also a well-known leader, having been president of so many specialty societies, and so gynecologic oncology, the one of ultrasound, and the one also of trophoblastic disease. Not only that, she has also become a legislator. She was a one-time congresswoman of the Zamboanga del Sur from 2001 to 2004. And she's definitely multi-awarded. So without further ado, let me call on our first speaker, definitely an empowered woman, Dr. Filomena T. Santiago-San of the Mu Sigma Phi sorority, batch 1978.
I'm Dr. Filomena Santiago-San, a sorority sister. I'd like to thank the Mu Sigma Phi sorority for giving me this rare opportunity and honor to speak on a very relevant topic of discrimination affecting women in our society and the solution of women empowerment to attain gender equality. This is the outline of my talk this afternoon. First, I will provide you the legal definition of women empowerment. Second, the reasons and the gender problems why we needed women empowerment. Third, the international initiatives and treaty to eliminate discrimination among women and attain gender equality. And finally, present to you the relevant Philippine laws that every woman and man should know to eliminate discrimination of women in this country. Now, what is the legal definition of women empowerment? According to Republic Act 9710, otherwise known as the Magna Carta for Women, Section 4. And I read, women empowerment refers to the provision, availability, and accessibility of opportunities, services, and observance of human rights which enable women to actively participate and contribute to the political, economic, social, and cultural development of the nation, as well as those which shall provide them equal access to ownership, management, and control of production, and of material and informational resources and benefits in the family, community, and society. So why women empowerment? We know that every 2 minutes, one woman dies during pregnancy or childhood. 39,000 girls become child brides every single day throughout the globe. 1 in 3 women will be beaten or sexually abused in their lifetime. Women just own 1% of the world's land, and women earn only 10% of the world's income. And 875 million of women don't know how to read or write. So why should it be that we have women empowerment? Because of this continuous discrimination of women at work, in government, or in civil society, continuous harassment of women at work or in educational institutions, and continued exploitation of women at work in sexual and human trafficking. Why is women empowerment needed in the Philippines? Discrimination in the field of military, police, and other services. There are more men approved to be included in these services. Discrimination and derogatory portrayal of women in the media and in film. There is lack of women health services, health information, and health education. When women are supposed to take care of the health problems of the family. There is lack of leave benefits for women who are working. There is lack of sick leaves and also of maternity leaves. There is lack of equal rights in matters related to marriage and family relations. There is lack of protection from all forms of violence physical or sexual violence, including those committed by the state. There is lack of protection during the times of disaster, calamities, and other crisis situations. There is lack of participation and representation in the government, in the ordinary salaried position, or even in the upper positions. There is unequal treatment before the law. There is unequal access and elimination of women in education, scholarships, and training. I remember that in the UP College of Medicine before, there were more males that were admitted to the College of Medicine. I think this has already changed because of the enactment of the subsequent laws. There is unequal participation in sports. Now, the Republic of the Philippines, through the Philippine Statistics Authority, reported that there is an increase of 15.1% in the number of physical injuries among women. And there is also an increase in 2017, according to the demographic statistics, increase of 30.6% or 2,162 rape, despite the subsequent laws on this. And there was also an increase of 3.2% in acts of lasciviousness, or 2,085 cases. In the different forms of violence in women aged 15 to 49, 13.3% are physical violence only. 1.7% are sexual violence in children. 3.5% physical and sexual violence in the child, and 18.5% physical or sexual violence in adult women. The top 3 reported sexual violence perpetrators are the following. Among the married women aged 15 to 49, 49.4% accounts perpetrators were current husband and partner. 32.2% perpetrators of sexual violence are former husband or partner, and 7% sexual violence perpetrator are other relatives. Among those who never married, 20.2% of the sexual violence were perpetrated by own friend and acquaintance, 17.6% by other relative, and 16.8% of sexual violence perpetrator are strangers. The top 3 reported physical violence perpetrators are the following. Among those who are married, 47.5% of perpetrators of physical violence are the current husband or partners. 24.7% of perpetrators are former husband or partners, and 15.6% of the perpetrators are the mothers or the stepmothers. Among the never married women, 26.1% of perpetrators of physical violence are the mothers or the stepmothers, and 25.3% are the fathers or the stepfathers, and 19.2% are either the sister or the brother. So it occurs, physical violence occurs in the family, in those who are not married. Now, this graph will show you the trending of women elected into public office, executive and legislative at the national and local levels. So beginning at the 8th Congress in 1987 to 1992, there were only 10 women elected into executive and legislative positions of the government. Now, throughout the years, after 20 years, in the 13th Congress, from 2004 to 2007, there was only an increase of 7%, so a total of only 17%, not even 1/4 of the seats in the executive and legislative assemblies were women. So we really need to increase the number of women in our executive and legislative, as well as the judicial branches of the government, in order to have this gender equality achieved. Now, Mayux in 2000 presented the framework for women empowerment in different spheres of life. First of the framework is the women to have the power within. They should have the ability to articulate their own aspirations and strategies for change. For example, in my case, in my province, I noticed the lack of health infrastructure and resources that I conveyed this to my family, relatives, and political parties and women's groups. Second, the Power to framework, enabling women to develop the necessary skills and access the necessary resources to achieve their aspirations. In my case, in my province, I tried and studied to be a doctor, went to part-time private practice to financially empower myself to provide free medicines to marginalized rural areas in my free medical outreach missions in the province. Third framework is the Power Will, enabling women to examine and articulate their collective interests, to organize, to achieve them, and to link with other women's and men's organizations for change. So in my case, I organized a tambal sa barangay group so that empowered women can collectively organize themselves to provide cheap generic medicines for common diseases in the barangay. And also to provide the venue to discuss the absence of a secondary or tertiary government hospital that everyone needed in these areas where there are none. Fourth of the framework is the Power Over, that is changing the underlying inequalities in power and resources that constrain women's aspirations and their ability to achieve them. So in my case, because of the presence of political dynasties that never responded to the health needs of the people in my province, I ran for Congress against all odds, against all 3 Gs of the opponents, the guns, goons, and gold. And once elected, I now had the power to question the Department of Health of their inability to provide the regional hospital infrastructure and medical resources, which led to the establishment of the delayed implementing rules and regulations of the law creating that regional hospital, and a compromise with the department secretary to provide the 350 million pesos to establish the tertiary regional hospital, so that today that Macrh regional hospital is now a 150 beds providing services needed by the poorest towns in the province. So even the isolated coastal municipalities can avail of the services of this regional hospital. Now, because of these problems in the international arena, the United Nations, through its leadership in September 1981, started the Convention on the Elimination of All Forms of Discrimination Against Women. Most of those who attended this convention are, of course, women from different countries in the world. A United Nations Women's Initiative, the Convention on the Elimination of All Forms of Discrimination Against Women, resulted in the CEDAW International Treaty, where our country is one of the signatory. This CEDAW Treaty provided the document that all signatory nations shall uphold equality of men and women before the law and in all political exercises, equal educational rights and access to information, non-discrimination against all women in all family matters, including reproductive rights, actions that suppress and prevent sex trafficking and prostitution of women by creation and enactment of legislation measures for these purposes, which include the discouragement of socio-cultural practices that perpetuate gender bias and prejudices and stereotypes. According to Article 12 of the CEDAW International Treaty, the state requires that the state party to eliminate discrimination in healthcare. The state should prevent unwanted pregnancies by making a comprehensive range of contraceptives more widely available and affordable without any restriction, increasing knowledge and awareness about family planning. This treaty also recommends to provide sex education to adolescents with special attention to the prevention of early pregnancies and sexually transmitted diseases. Consider the problem of unsafe abortion as a matter of high priority. This led to the United Nations Fourth World Conference on Women in Beijing, China in 1995. This Beijing Declaration and Platform for Action consisted of 12 critical areas of concern which should be taken care of by the different countries in the United Nations. The Platform for Action calls for all signatory governments to come up with their concrete actions in women and poverty, education and training of women, women and health, violence against women, women and armed conflict, women and the economy, women in power and decision-making, institutional mechanisms for the advancement of women, human rights of women, women and the media, women and the environment, and the problems of the girl child. Because of this Beijing platform in 1995, and also because of the CEDAW International Treaty, our government, the Republic of the Philippines, initiated laws for women empowerment and gender equality, one of which is the Republic Act 7195, otherwise known as the Women in Development and Nation Building. This is a recognition by the state of equal footing between the sexes and that women are just as essential as men in the building of the nation. Before the state, men and women are fundamentally equal. This act ensures an equal playing field for men and women. Example, in all government institutions and elsewhere, such as contracts and loan agreements. This law recognizes the role of women in nation building, which was and shall ensure the fundamental equality before the law of women and men, which is enshrined in the 1987 Constitution, Section 14, Article 2. Another law is the Republic Act 7877, or otherwise known as the Anti-Sexual Harassment Act of 1995. This act ensures that the dignity of individuals are preserved and that human rights are respected. It pronounces as unlawful all forms of sexual harassment in the job and educational arenas. The act considers it a primary role of employers and heads of training and educational institutions to ensure against these illegal acts and to have established sanctions and rules against them, and shall be held liable if no action is taken when these events occur. So, sexual harassment in this law is defined as one that is committed by an employer, employee, manager, supervisor, agent of the employer, teacher, instructor, professor, coach, trainer, or any person who, having authority, influence, or moral ascendancy over another in a work or training or education environment demands, requests, or otherwise request any sexual favor from the other, regardless of whether the demand, request, or requirement for submission is accepted by the object of said act. Another law to empower our women is the Republic Act 8353, the Anti-Rape Law of 1997. This is a revision of the Penal Code, which considers rape as a crime against persons. The definition has been modified beyond carnal knowledge or actual sexual intercourse of a woman under certain circumstances, and sexual assault to include the insertion of objects in the genital and anal openings. Under this law, in cases where there is marital rape and the offender is the legal husband, the penalty is extinguished upon the wife's forgiveness. Another law is the General Appropriations Act by Congress in 1995 to 2000. This act stipulates that all government agencies to have a gender and development plan for women, which is to receive not less than 5% of their annual budget. So all the branches of the government in the executive, legislative, and judiciary are mandated to allocate not less than 5% of their annual budget for the gender and development of the women employees. Now, this is the Republic Act 9710, or an act providing for the Magna Carta of women. This is a very important law for women because this contains the Bill of Rights of Filipino women. And this was only approved when our second woman president was sitting as the president of the Philippines. President Gloria Macapagal Arroyo signed it in August 14, 2009. Republic Act 9710, or the Magna Carta for Women, seeks to eliminate discrimination against women by recognizing, protecting, fulfilling, and promoting the rights of Filipino women. These rights include all rights in the Philippine Constitution and those rights recognized under the international instruments signed and ratified by the Philippine government. Among these rights in the Magna Carta for Women are the following: the non-discrimination in employment in the field of military, police, and other similar services, non-discriminatory and non-derogatory portrayal of women in media and films, a comprehensive health services and health information and education for women, increasing the leave benefits of women, including the leave during delivery of their babies, equal rights in all matters related to marriage and family relations. Among these rights are protection from all forms of violence, including those committed by the state, protection and security in times of disaster, calamities, and other crisis situations, participation and representation in government, equal treatment before the law, equal access and elimination of discrimination against women in education, scholarships, and training. I will remember that before, the College of Medicine of the UP College of Medicine had more males than female admitted in the College of Med. But now, because of these laws, they have already changed and equalized the number of women and men to be admitted in the College of Medicine. This Magna Carta also provides equal participation in sports. The Magna Carta for Women also guarantees the civil, political, and economic rights of women in the marginalized sectors in the rural communities and in rural areas in Mindanao and the Visayas. The law also renames the National Commission on the Role of Filipino Women, or NCRFW, to Philippine Commission on Women, or PCW, with stronger and wider authority and coverage. The law also mandates the Department of Labor and Employment, the Department of Social Welfare and Development, and the Commission on Human Rights, or CHR, to help strengthen the Philippine Foreign Post programs for the delivery of services to women migrant workers, so that our OFW women will also have the rights even if they are stationed abroad. So the challenges in the implementation of this Magna Carta for women is the stakeholders' responsiveness. We have to make sure that all the stakeholders, from the national government up to the local government units, be able to implement all the provisions in this Bill of Rights for women. And then it translating into action and results the provisions in the Magna Carta for women, and providing guidance and inspiration for other women that this Bill of Rights is a model to protect their rights as an individual. This graph would show the women in national legislature from 1992 to 2001 to 2004 vis-a-vis pro-women laws. So the women elected in Congress is the one in violet, and the women and the laws, pro-women laws that were enacted in Congress is the line in yellow orange. So you will see that in 1992 only about 9% of the seats in Congress were occupied by women, and but at that time they were more women laws because they were starting to consider the women gender as an equal footing with men. Then after about 20 years, in the year 2001 to 2004, there were only about 17% seats in Congress, both in the upper and lower house, that were taken by women. But you can see the improvement in the number of pro-women laws that were enacted during that time. It was during this 2001-2004, where I was also elected in Congress, that we were able to enact the Anti-Violence Against Women and Children law. And this has been lying down in Congress for a long time. And it was only when the Women's Committee tried to approve this in the committee earlier during the first year of in Congress, that we were able to have this approved by the lower house and also in the Senate, and finally signed by our woman president, President Gloria Macapagal Arroyo. So we need to have more women there. If we only occupy 17% of the seats, we need to increase it to about 50%. And I think if women will be there, they know about the problems of health. Usually they are the ones left at home and take care of the health of their children, and also of the women's problems to be heard in Congress, and they will be able to legislate laws that will have gender equality and eliminate discrimination of women. Now we go back to the international scene. The United Nations developed the Medium Development Goals, or MDG, in 2000 to 2015, but none or most of these goals were not achieved by the third world countries and the developing countries, even the Philippines. So they continued with the 2030 Agenda for Sustainable Development until 2030. And health-related sustainable development goals were included in the first 6 of the SDGs. So sustainable development goal number 1, that global-wise, we should be able to eliminate poverty by 2030. I don't know how can that be. And number 2, to eliminate hunger by 2030. Number 3, good health for both men and women by 2030. Quality education for both men and women by 2030. And note that the SDG number 5 concerns gender equality. So we have to see that global-wise, there would be gender equality among men and women in all spheres of the society. And number 6 is clean water and sanitation, SDG. These 6 goals address the various key issues of public health: poverty, hunger, food security, health education, gender equality, women empowerment, and sanitation. So because of the lobbying of women in the United Nations that were actively involved in all their meetings, so we were able to include gender equality as the number 5 sustainable development goal for 2030. Because of the previous Beijing platform for empowerment of women and the CEDAW International Treaty in 1981, the Philippines finally enacted Republic Act 9262, or the Anti-Violence Against Women and Their Children, or Anti-VAUC, in 2004. This was the time where I was also in Congress and I co-authored this very important law. It is a special law, otherwise known as anti-violence or anti-VAUC, which penalizes as a public crime certain acts of violence against women and their children. Now, what is violence against women and their children? It is legally defined as violence against women and their children, or VAUC, as any act or a series of acts committed against the victim which result in or is likely to result in physical, sexual, psychological harm or suffering, or economic abuse, including threats of such acts, battery, assault, coercion, harassment, or arbitrary deprivation of liberty. It took a long time for this law, the Reproductive Health Act of 2012, to be enacted in Congress. There were so many discussions and debates and objections to the different provisions of the law, especially with regards to contraception, fertility control, and sexual education. So certain communities vehemently fought in Congress, so that when this law was enacted, the Responsible Parenthood and Reproductive Health Act of 2012, also known as Reproductive Health Law or RH Law, this officially designated as Republic Act number 10354, is a Philippine law that provided universal access to methods of contraception, fertility control, sexual education, and maternal care in the Philippines. Even when this law was approved and signed by the President in 2012, there were still so many upheavals and objections in the Supreme Court just to prevent the implementation of these laws. But because of the different women's organizations, both young and old, who fought for the final implementation of this law, this was finally upheld by the Supreme Court of the Philippines as constitutional. And therefore, we now have this beautiful law which will protect women and help women in their reproductive health. In summary, I presented the legal definition of women empowerment according to the Magna Carta for women. I presented the reasons why we need women empowerment. The solutions were presented through the United Nations agenda and initiatives, followed by the enactment of Philippine laws that protected Filipino women, including the Magna Carta for Women, the Anti-Violence Against Women or Anti-VAUC, and the Reproductive Health Act in 2012. My recommendations after this discussion and lecture are the following. One is to empower women to be vigilant in monitoring that all pro-women provisions are implemented by stakeholders in the government and private sectors, not only in the urban, but in the marginalized rural areas as well. Number two recommendation is for all women and men to study the provisions of the Magna Carta of Women and other laws against discrimination of women for their education, for women empowerment, and compliance with the laws. My third recommendation is that I would like to appeal to our government and empowered women groups to lobby and create laws and department executive orders for women in difficult circumstances, such as women in extreme poverty, widowed, deserted, and separated women, forced prostitution and trafficking of women, women of alcoholic and drug addict husbands, women with physical disabilities, unwed mothers, women in conflict with the law, and women prisoners, women workers in bondage, women used as drug peddlers, women used in pornography, and victims of socially sanctioned cultural practices. It has been an empowering afternoon for women and as well as educational for men. I'd like to thank you for listening for the last 30 minutes. Thank you for your kind attention. Good day and keep safe always. Thank you.
Thank you very much, Dr. San Juan, for that very comprehensive talk. It was just like a crash course for me, no, about women's rights, the laws, no. So thank you very much for navigating us through the many facets of women empowerment, and of course the laws, and of course the recommendations. So now we reserve the questions for later. Now we now move on to another empowered woman. Our second speaker is Dr. Carmencita M. David-Padilla. Is a proud alumna of the UP College of Medicine class of 1981. She is currently the Chancellor of the University of the Philippines, Manila, on her third term. No? And while she's overseeing the entire university, the University of Manila, she is also an academician of the National Academy for Science and Technology, Professor 12 of the UP College of Medicine, Department of Pediatrics, and a University Science 3 at the University of the Philippines system. She's definitely one multi-awarded woman. And why not? Because she has so many things that she pioneered, no, and contributed to the growth of the country, including setting up the genetic services at UP Manila in 1990, the newborn screening services in the Philippines in 1996, the Philippine Genome Center in 2009, and initiating the fellowship program in clinical genetics in 2000, as well as the Masters in Genetic Counseling in 2011 at the UP College of Medicine. Of course, she crafted and lobbied for the Newborn Screening Act of 2004 and Rare Disease Act of the Philippines. So definitely one pioneer woman, very empowered. So it is my honor and pleasure to call to the floor the Chancellor of UP Manila, Carmencita M. David-Padilla, Mu Sigma Phi Sorority, Batch 1981.
Thank you very much, Dr. Toral. And it's always a pleasure to join activities of Mu Sigma Phi. And I'm really happy to be part of this webinar today. I've been asked to talk about women empowerment in the academe. And when I was thinking about this topic, I was tossing around whether I will just share my experiences or whether I would actually expand that to other people. But before I go to my presentation, I was just looking at the book of Dr. Camarabesa because I was trying to look at how were women in the 30s and the 40s. And all I can tell you is that in the 30s and in the 40s, if you're a woman who's married, it's so difficult to get into the College of Medicine. So what am I saying? We're very happy that there are many women at the UP College of Medicine. And for that, it only means that through the decades, through the half a century, things have changed. So I made a check of gender balance in administration. And I can tell you that at the Office of the President, she has 3 women as vice presidents and 2 men as vice presidents. And as far as for my team in UP Manila, I have 2 vice chancellors who are women and 2 who are males. And for the deans, I have 4 females. I have 4 males and I have more women. I have 5. So it only means that we've reached a point where in women, people don't look at you as a negative factor being assigned to a position as compared to the time of Dr. Camarabesa in the 30s and the 40s. Right now, I'd like to believe that here in UP, we are equals. So let me share my talk now. And I decided to give my talk, Meet the Empowered Academic Leaders. I can spend a lot of time talking about my life, but I think I thought of another way of presenting this talk. So instead of giving you my definition, which you can actually probably pick up, and I've learned a lot today from Dr. Nanette, I've decided to actually bring to this meeting a number of empowered women leaders in the area. So Sister Christine is the president of St. Scholastics College. Dr. Karen Castaneda is the vice president in Adamson University, and Dr. Marie Chen is actually the vice president for academic services in St. Paul's. And from the UP front, I've interviewed Dr. Eva Cotionco de la Paz, the Executive Director of NIH, Dean Sheila Bonito, the Dean of the College of Nursing, Dean Marily Aguila, the Dean of the College of Allied Medical Professions, and of course our very own Joy Canyal, who is an assistant to the Vice Chancellor for planning and development in my administration. So what I did was actually I have 3 questions that I posed to them, and I really thank them for taking time to respond to my questions. And I think instead of just learning from me, you are going to learn from 7 women plus my insights towards the end. So I asked them, what is your definition of women's empowerment? And well, Dr. Eva said, women empowerment is all about giving women equal opportunities to lead, to create, to build, and to influence the next generation for a better tomorrow. An empowered woman in the academy means I had the opportunity to be mentored and nurtured by women who served as my role model. Dr. Karen said it means liberty to express their freedoms and live their life to the fullest without any interference and curtailment of rights. Very different from the scenario of Dr. Julita Camarabesa. By the way, for those who are very young in the audience, she's a pillar in biochemistry, and she has taught decades, a generation of doctors. So if you compare to her time, now we're talking about the liberty to express freedom, which was not present in the 40s in the College of Medicine. For Dr. Marie Chen, when a woman is able to exert her right as an equal, while knowing that she is also unique because she is a woman, when she asserts her decisions because she believes she has studied all the options and the people who listen have faith that she did. And for me, a woman is empowered when her presence and leadership improve the image of other women, get the respect of men, and make an impact to the community and society. For Dr. Christine, women empowerment is women having a voice, especially in matters that affects women's rights and the marginalized. women in positions of leadership, women able to pursue any career without any discrimination, gender, and equality. For Dean Sheila, women empowerment for me is having the ability to make choices, to challenge access to opportunities and resources that would support making these choices. And for Dean Marily, women empowerment to me is having opportunities to be an agent of change and being free to make choices to push that change. Having these opportunities to change, although we're in the hearts and minds of women decades back, was difficult in the 30s and the 40s and probably even stretching to the 50s. And you can see what Dr. Nanette showed us, that there's been a big move for legislation to make sure that there is no hindrance to being a woman. And of course, for our dear Joey, woman empowerment, when we can freely try new ideas and try out new ideas, and we are free to determine our own path. We are free to make our own mistakes and learn from them. Just from the presentation of our women leaders, it is very obvious that the independence of thinking is a crucial component of women empowerment. It is also clear that there is a desire to exert change by just being a woman, not necessarily competing with another gender. There is a desire to think of options and get the support of the men in the final decision presented by the woman. So empowerment is really being able to make decisions and get everybody, whether man or women, to see your strength as a woman in making that recommendation. So what is important now is that for the women, just what makes a woman empowered? I mean, when I was reflecting this question, I also asked myself, how did I end up to be an empowered woman? Yes, I accept, I believe that I am empowered, but what made that happen? Is it genetic? Is it something environmental? Is it a mix? Let us see what our academic leaders have to say. So Dr. Eva said, I think, I became empowered because I was a good follower. And, she said that eventually I became a good leader. I was open to learning from those who know more and older and wiser than me, and that I wanted to be relevant and embrace change. So in other words, there is a willingness inside you that you want to make a difference, because if you're empowered, it's not enough. It is not enough that you have what you have right now. You've got to make a difference and be relevant to society or to your organization or to your students or to your family. For Dr. Karen, it's the contributing factor will be a mind not stifled by man's inadequate laws and unreasonable demands. A mature attitude that sees the good in everybody and converting to good what's negative. So in other words, now you can't be empowered if you're always negative. You can't be empowered if you're always looking at the bad things. You are empowered because you see the good things, the powerful, the positive things about everything, including the negative things in our lives. For Dr. Chen, what contributed to her empowerment? Education, continuous learning and development, respect for self and others, courage, ability to stand on my ground, humility to know when I'm wrong and when I need help, and the ability to communicate my thoughts clearly without acting proud. Actually, she had a very long list, but this is the most important ones. But the thing is, you see, by continuing your education, you become empowered. That's basically the message. You have to continue studying. It can be studying about life, you can go back to school, but basically anything new that you learn adds to your empowerment. Another contributing factor is being surrounded with other empowered women. And looking back, she said, I have been with many empowered women and they have inspired me. And I was reflecting the number of women who have surrounded me in the past 30 to 40 years. This is actually true. We, during our growth years, must be surrounded by both men and women. And there are so many empowered women, even before the word empowerment came to light. So look around, because that's going to be important as you get to the next ladder of your academic career. For Dr. Christine, being in the religious order, it's the congregational and institutional thrust and commitment to women empowerment, the mentorship of empowered women, the consortium and collaboration among women's colleges. For Dean Sheila, academic preparation again, continuous learning, postdoctoral fellowships, leadership training. So in other words, sometimes you have to go through a course to become a better leader. Assumption of administrative positions, because each time you're given a task, then you learn something new, and then you become maybe better prepared for a higher position. And you can see here that even researchers leading projects has actually added to her empowerment. For Dean Marili, the biggest contributing factor to my empowered state were the values instilled in us siblings by the family. So you can see here the role of the family, wherein the roles are not dependent on gender, when we are encouraged to discover ourselves and even make mistakes. So making mistakes is part of the game. You cannot be, it cannot always be a bed of roses. You've got to learn the mistakes, stumble along the way, because when every time you make a mistake, you know better next time, and somehow adds to the formula of empowerment. And of course, this time from our dear Joey, the fever of education. Other women who have shown what is possible. And for that matter, other men who have shown me what can be done. I think the company I keep is so crucial. My husband, the family, the friends, the colleagues are enablers. And I have to admit, my stubbornness contributes to my empowerment. So being timid does not really, I think, as in general, I've looked at the women, I've looked around. Being timid and being shy, shyness has to happen to only at a certain level. But being timid is not going to get you there. By stubborn, it means that you don't readily accept what is being mentioned to you. But at the end of the day, it's still education and the family that actually brings the best out of you. My last question to them are, what are the new challenges you have to face? Now, you see, being an empowered woman, then you go up the ladder. When I say the ladder, it's not only the academic ladder, it can also be the administrative ladder. And they said, for Dr. Eva, she said, the challenges now is the VUCA world, very volatile, uncertain, complex, ambiguous, just like COVID. I mean, this is what you call the VUCA world. Having to shift to remote learning, that's actually VUCA world. So in other words, we need leadership decision-making under the complexity that are solution-oriented. So I think, I don't know, I was looking at the participants, I probably have getting an age range across the decades. You've got to start making decisions really early. And the more complex the problem is, the more learning you will have. So never say no to difficult situations, because you become a better person when you deal with difficult problems. For Dr. Karen, the challenge is nurturing students' minds with progressive ideas that can push the buttons in every student. You've got to downplay the negative vibes. You see, this generation is very different from the time when I was young, in high school, in college, and even in medicine. And the level of the way I say, the students now are full of ideas, and we as mentors should be able to nurture them to the best of our capacity. And of course, with mental health an issue during COVID, we've got to downplay the negative vibes. For Dr. Chen, the challenge is how to inspire young women to be empowered in the correct definition of the word, so that these young women do not get confused with self-promotion and arrogance as empowerment, gender, and equality. That's interesting, because being empowered is not about arrogance. It's not about self-promotion. Being empowered is being yourself, being a better person, being a better woman for the betterment of society. For Dr. Christine, the challenge is financial stability and sustainability of the institution. This is on her side, being part of a religious order and being the head of the institution. The battle against new forms of violence against women, especially the cyberbullying and women and child prostitution. For Dean Sheila, it's the juggling of fulfilling tasks in different roles. You see, when you go up the academic ladder, administrative ladder, you're a teacher, you're a researcher, you're a mentor. You've got to deal with so many, not only the admin, but also the family. So in other words, these are the challenges that you have to face. But if you're an empowered woman, you can do it. You can make it. for Dean Sheila, rather to Dean Marili, it's the challenge is to be able to be a good role model for empowerment too. Well, this is interesting. The challenge for Dr. Joey is, aging said, there are still things I think I can still do, but I can no longer can. And honestly, it's getting harder and harder to keep in touch with young people, and they're so difficult now. But this is why I insist on being with the students so that I do not lose touch with their generation. So as you can see from the spread of my women leaders now, the temperament of empowerment actually spans a spectrum. So women empowerment is giving women access to equal opportunities, the liberty to express freedom and exert their rights, the ability to make choices and opportunities to be agents of change. All the women that we've met today, they wanted to make a difference. And that's why they're all in a leadership position right now. You will not be in a leadership position if you do not want to effect change. The contributing factors in becoming an empowered woman in the academy would be, first is this is a good thing, being a follower when you're young. Learn from the people around you. Choose the best from all of your mentors. For myself, I have many mentors. And I'd like to pick out good things from each of the people I've worked with. The other factor is having an open mind and a mature attitude. An open mind means accepting that your idea is not always correct. Accepting the concept that it is possible that somebody knows more than you do. The next point is being relevant and able to embrace changes. Education, continuous learning, development. The second part is remembering one's course values. And you can see another factor is mentorship of empowered women. So in other words, when you mentor another student, another woman, that in itself is an exercise of empowerment. Now, what are the challenges? Nurturing other people's minds and becoming an inspiration to other women. I think this is something that we are unconsciously doing. I'd like to believe that empowered women are not even aware that by being an empowered woman to another woman, she is actually an inspiration to the other woman. Challenges is downplaying the negative vibes, juggling time, as you go up the ladder. And as you can see here is, the challenge of an empowered woman is making sure that you just don't keep it to the people of your age. You've got to make sure that you also mix with all ages, because we can also learn from the young. So today, I'd like to invite all of you. I'm sure that you've been able to find yourself in one of my 8 empowered leaders here, and that you will have your own story. If you're watching this webinar, it means that you are starting to be one if you're young, or you were just validating your suspicion that you might be an empowered woman. Now, I believe that everybody has the power. Everybody has the ability. It's a matter of starting right now. So I want to thank everybody for this opportunity of sharing the stories of these women who are part of a group of empowered population. And I can tell you, I can write a book talking about the empowerment of women, even just here in UP. Maraming salamat po sa inyo lahat, and good afternoon. Back to you, Dr. Jean.
Thank you very much, Chancellor Padilla. That was a very inspiring sharing of stories of 8 great women, all empowered. And that makes perhaps many in the audience to look, where am I? Am I at the level of the self, having that power within, or are you already in that part where you are taking the necessary tools so that you become empowered, like education? Or are you now already in the collaborative stage, or already on the part of having that power to change things? No? So it's a thing that you have to look into yourselves. Thank you very much, Chancellor Padilla. And now we move on to our reactor, another empowered woman, let me call to the floor our reactor, Ms. Noemi G. Azura. Ms. Noemi is the President and CEO of Insular Healthcare and concurrently the Senior Executive Vice President and Head of Digital Insurance and Program Director of InLife Sheroes at the Insular Life Assurance Company Limited. InLife Sheroes is a movement that puts women together, and perhaps Ms. Noemi will talk about their advocacies. She is definitely an empowered woman in the field of business and health, also multi-awarded. So let me call to the floor Ms. Noemi Azura.
Thank you, Doc Jean. Good afternoon, everyone, and happy International Women's Day to all the sisters of Mu Sigma Phi and to all the women and the honorary women in the audience. So first, I would like to share my reaction to the talk of Doktora San Juan. Dr. Filomena San Juan's talk resonates with me and perhaps with many of us. She shared many examples of discrimination, harassment, and exploitation of women in our society, including the very concerning statistics on violence against women, which are the compelling reasons why we need women empowerment. The Magna Carta for Filipino women is a good start, and legislative action should continue. And yes, Dr. San Juan, we will be vigilant on the enactment of these laws. I am also inspired and encouraged by the works of Doktora San Juan. She exemplified courage when she ran and won against the political dynasty that led her to set up a regional hospital in the province. She also implemented women empowerment program in her own province, covering access to health care services and to affordable medicines. So mabuhay ka, Dr. Filomena San Juan, for all your works in helping other women. My reaction to the talk of Dr. Padilla, I'm very happy to hear that there's gender balance in the academe of UP Manila, where women are well represented and are thriving. And I agree absolutely with the contributing factors that led to women empowerment that was shared by the different women that she interviewed. So education, mentorship, role model, positive attitude, values formation of the family, and resilience or bouncing back from failure. And if I may add, having a supportive husband or partner is also a contributing factor for me. And also having the courage to get out of my comfort zone and respond to opportunities in this VUCA world were also contributing factors. And if I may also share my definition of an empowered woman, for me, it would have two sides. So the first side is about self-fulfillment. An empowered woman is someone who is able to reach her full potential, but the other side of it is the purpose. But the purpose of reaching her full potential is to deliver positive impact to society. Mabuhay ka, Dr. Padilla, and all the inspiring women in your talk. Now, let me share a women empowerment program for the business sector. In 2017, Insular Life or InLife, one of the largest life insurance companies in the Philippines, forged a partnership with the International Finance Corporation, a member of the World Bank Group. InLife's HMO subsidiary, the one that I lead, InLife Healthcare, also supports this program. The partnership is called InLife Sheroes, a women empowerment movement that aims to help women live healthier, wealthier, and more meaningful lives. It has 4 focus areas. The first is financial education. Second is health and wellness education. Third is connecting women to social and business networks. And fourth is developing customized health solutions for women. And based on our market research, Filipino women are the chief finance officers and the chief health officers in their homes. So InLife decided to empower women through financial and health and wellness education to help them make informed decisions about money and about the family's well-being. Also, this is very important. Women need to take care of themselves and maintain good health because good health is necessary for continuing employment or entrepreneurship in order to achieve economic empowerment. The In Life Sheroes promotes its educational content through digital channels like In Life Sheroes website and YouTube channel. Educational talks are also delivered through webinars and during the pre-pandemic through face-to-face seminars and workshops. And as of October 2021, the In Life Sheroes movement has reached and touched the lives of more than 5 million Filipino women. Another important element of the In Life Sheroes Women Empowerment Program is partnerships. So we cannot do it alone. So we need to partner with like-minded organizations like Mu Sigma Pi. And we have a shared advocacy on women empowerment. In Life Sheroes provides sponsorship to the Wealth Program of Mu Sigma Pi. Wealth stands for Women Empowerment and Literacy through health education. The Health Caravan taps communities through the LGUs and offers health education, breast exam, cervical cancer screening, and immunization to women in the community. So recently, we also provided sponsorship to MSP for its series of virtual health forum every second Tuesday of the month. This is one such forum from July 2021 to June 2022 entitled MUla kay Doktora, Dr. Julita Ramoso-Jalbuena Memorial Women's Health Program. We are promoting the webinar series and the recordings in the In Life Sheroes YouTube channel. So mabuhay Sigma Pi! At this point, I would like for all of us women to remember the quote of Madeleine Albright, the U.S. Secretary of State under President Bill Clinton. And this is her quote: "There's a special place in hell for women who do not help other women. So see you all in heaven." Thank you.
Thank you very much, Miss Noemi, for your reaction. Now it's time to call on our two speakers and Miss Noemi to open their cameras so that we can answer the questions in the open forum. Miss Noemi, let's put a spotlight. Okay, good. So I think it was a very empowering afternoon. No, so I was reading through the daily today, and because it's International Women's Day, the editorial said the title was "A Woman's Place Out There," and it mentioned, because Chancellor Padilla has already, I think, emphasized that in the academy, it seems that there is already gender equality, no? And in the business, Philippines is number 3 among the countries wherein there are many women who are already in executive offices in business, no? But I think the gap is in politics. So, Ma'am Filomena San Juan, can you comment on the gender gap in politics here in the country?
Yeah, as you saw in my graph, in 20 years past, we just increased 7% the number of women in the executive and legislative branch of the government. I think there is still that cultural, you have to change the culture of the Filipinos, that women are also as able as men in holding offices in the executive, judiciary, or even in the legislative branch of the government. So I think it's really because, money, women only holds 10% of the finances, global-wise and even locally. So, they're running into politics needs a lot of money. How to go about with campaigning and, getting the resources for you to protect your votes. You have to have the lawyers with you and those who will protect the ballots. So if women do not have that money on their own where they can spend, then it will be very difficult for women to really go into and be elected in office, because women have many roles. Unlike men, they can leave the family only to women and they can just go on with their political agenda. But women have to take care of the family, have to share, sometimes you have to ask your husband, how to spend your money. And if you use it in politics and your husband is not a politician, it will be very difficult to use that. So maybe another way is empower yourself. Go into make groups, women's groups, and then discuss what are the problems in that municipality or provincial level, and then ask the people, that you have this agenda to them. So you have to go out there. You cannot just be in the house. In order to win in politics, you have to be involved in the community. Thank you.
Dr. Chancellor, do you think that you're not in politics, but do you really think that there is a need for one to cross over politics to be able to have that empowerment? Of course, for you, the answer is a no, because you were able to make the changes even without going into politics.
Well, it's always nice to have more women in all the fields because it has its own calling. So that means if we are able to get more women to have that kind of calling, then it will work. But if we don't have enough, then we have to find another way to institute the changes. I think, what we have to think now is that if we can all think of a bright idea, and we will have to find a way to change. I mean, in my case, I didn't have to be a congressman to have my 2 laws passed, and I'm helping government to implement. So, I mean, it's very focused, it's different from what Dr. Net's doing, but I was able to achieve my goal of getting a program implemented. So I think it's kanya-kanyang calling. We just have to find a way how to be able to effect change regardless of what position we have.
Yeah. Okay. Maybe I can ask our reactor, Miss Noemi, because the problem, you said financial literacy is one of your programs. But how can there be a program, let's say, if a woman doesn't have the money? So how can that be? Of course, that's a problem. How can that be addressed?
Yeah, so I think earlier, Doktora Padilla shared that education is one of the contributing factors to women empowerment. So I think education for all should be, I don't know if legislated, and free. Free education for all from grade school to college should be legislated, and there should be a quota on the participation of women. So I think that's very important. Second, that was also shared earlier, is the values formation in the family. That parents should nurture their girls to not to have this limiting mindset, but to have this boldness about her, that she can be whoever she wants to be despite a limiting environment. So it's really nurturing that will to become an empowered woman. But of course, if the environment is favorable, then the chances of success is even higher. So I think Dr. San Juan shared that the reason why there are less women in politics is economic. So economic finance is really a problem. And that's why it's not just financial education. That's our third pillar, is connecting women to social and business networks, which is really activating the women-led small businesses. Because women, they don't need to get MBAs to be empowered. They just need to learn how to cook. For example, basic food, set up a small carinderia in their community. And that requires very minimal capital. And there are resources to access, to set up that business. So for example, one of our partners is Google, the Discarding Pinay. What they do is they have a YouTube channel where they promote livelihood. So all recipes, banana Q, all the Qs, barbecues, banana Q, kamote Q, and they promote that so that women can watch the video in the sites where video access is free, so that they can come up with their small cart or carinderia in the areas, because that is a way to empower women in simple and immediate way.
Yeah, thank you for doing that, your movement, the In Life Sheroes. But I want to ask Dr. Chancellor, how far have we gone as far as free education in the Philippines?
Well, of course, I think when you say free education, it's all the way. That's the part I really appreciated what Ms. Noy said, because there's a very huge dropout along the way. even if education is free until high school, and we have free education in the government schools, but not everybody will be able to even avail of that for many reasons. Some may have to work immediately. So I think when you say that you want to give the opportunity for education, we cover the other needs of the family so that the girl can actually go to school. So I think we've got a long way. There's a big dropout, and I know for a fact that others do not continue on just because they have to earn a living to be able to support the family. I believe that education is a major factor for empowerment because when you know your rights, even just for the self, you see, empowerment does not always have to be society. Empowerment can just be for the self and the family. So I'd like to send that message that I'm not always talking about the country or the university, but being empowered can be very personal so that you can make decisions at home, so that you can be an equal when you're in the house. So I don't get the message that to be empowered, you've got to be doing something really big. It starts with the small ones. And that's why we talked about the family, the core values at home, because that starts with how you can be empowered as an individual.
Yeah, that's right. Ms. Noemi, do you have any questions for our two speakers? In particular areas like the violence against women, which will probably just also start, the home, the family is actually the first thing, they have to secure so that we can be empowered. But at the same time, it can also be the scenario or the scenario where the empowerment is hampered. Any of you would like to have comments on, violence committed at home or in the,
Actually, I
Ma'am,
just want
yeah.
to ask Dr. San Juan and Doktora Padilla on like the top five contributing factors to their empowerment, their personal experience.
Maybe we'll have Doktora Filomena first. Ma'am Nanette.
Yes, first of all, first one, you should know the problems where you can contribute in the solution of the problems. Especially me coming from the province, I saw a lot of discrepancies as well as in healthcare, especially. Number two, to empower yourself, to educate yourself so that you are empowered to know where to get the budget. For example, I'll make a very specific example. Our region, we did not have a regional hospital until 2010. So because there was a law more than 10 years before that, but the Department of Health did not do the implementing rules and regulation because the secretary was influenced by the dynasties in the area. So I need to run for Congress. I did not have any political background at all, but I realized that I cannot do it on my own. I have to use the government budget in order to empower me to have that budget given and establish that regional hospital. Because there are so many coastal islands and barangays there that have not seen a doctor at all. So I need to fight in Congress. So in order for you to fight, you have to be there. Otherwise, nobody will hear you. So I think you have to empower yourself. So educate. I have to study 1 year of law while I was practicing medicine, just to know COMELEC laws so that in order for me to protect my votes, because I have very little political leaders. And number two, I have to earn so that I can pay those who will spread my agenda to the different barangays. And in order for the people to know, because I grew up in Manila studying medicine, so nobody knew me in that very poor district 2 of Zamboanga del Sur. So I have to make my free medical outreach for almost a year using my own funds. So you have to empower yourself economically so that you can support this. And then during that time, that people would know that, you know, you need a Doktora, you need free medicines to improve the health of your barangay, because they have never seen, you know, health services given to them. So, but that is, you know, medical outreach is a temporary thing. You know, after you did your medical outreach, wala na. So you have to have laws to build that hospital. And so you really have to fight to fight in politics. And, you know, in that government committee, I even told the secretary that I'm going to block the budget of the Department of Health if they're not going to establish that regional hospital whose law was already given more than 10 years ago. So that's it. You need to be in the position to effect change. Thank you.
Chancellor?
Your question, Ms. Norio, is what were the factors that contribute to my empowerment? Well, for me, education was a given because I was, you know, I belong to a family that definitely my education is provided. But when I look back at my life, the few things that I could see that probably led to who I am today is there was the value of helping was within the family. So I think when you have that value of wanting to help, then you find the way of how do you help. Okay. And in my case, I didn't even think of as a woman. It's just that there was the desire to help. So that's one. Number two, as I think many people actually mentored me. Many people ahead of me, and I must admit that I've learned many leadership styles from different people, and somehow that contributed to who I am today. It's not only the women, it's also the men. So I have a lot of mentors, and maybe just to some people who probably know in the audience here, in the Music Mafia is, of course, Dr. Santos Ocampo, Dr. Amelia Fernandez, and Dr. Carmencita Domingo. They're all my mentors in pediatrics, which I think contributed to who I am. So I think for the young, you also have to look at your opportunities for learning from another person. You don't have to be like so close, but you know, what can you learn from that person? And I think, you know, for my position as a chancellor, I've had so many problems, and I think those problems even made me more empowered each step of the way. Setting up the national program in the country for newborn screening just made me too strong that anything really is really less than that. Because, you know, when you implement a program in 7,400 hospitals, which was unthinkable 30 years ago, I had so many problems. So the more problems you have, the stronger you get. The other thing that I think that has kept me to remain empowered is to trust God, because not everything will happen the way you want it. So I keep saying that you just accept what's happening because there must be a reason. So I think that's how I kept positive, that if something negative happens, I say there must be a reason. And I just don't see why. And every problem I encountered contributed to my empowerment. So I give a lot of credit to the people around me. And it's not always the old. It can be my peers. It can be the young. I love to be around people at old ages. And we should believe that being a senior citizen stage should not be a reason to be above anybody else. So I treat my peers as equals, regardless of age.
Yeah. I remember one time in a casual talk with you, Chancellor, I asked you what age did you start having this advocacies, and you said 30. Sabi ko, oh, I'm 20 years late. But I guess age should not be a hindrance to starting or, you know, getting your starting your advocacy. There's one question here. How do you educate people who, due to cultural upbringing, still consider women not deserving of leadership positions as they are too weak, quote unquote? So how do you educate people due to their cultural upbringing? Ma'am Chancy, would you like to answer?
It will always happen when a group thinks that a man can do it better. And I think the woman will just have to show that they can do it even better. Because it unfortunately, when you are in a position wherein you're not readily accepted, that's the only way. And that's why I mentioned the story of Dr. Camarabesa. If you go back to her book, it was having a woman who was married was taboo in the College of Medicine. She was not accepted because she got married, because she was to get married to her career. So in other words, perceptions change. But for anybody wherein there's a cultural problem, I think just prove your worth. And then eventually they will accept you.
Okay. Do you have an answer to that also, Miss Noemi or Ma'am San Juan, on that people with cultural upbringing that women are really weak?
I think it's already enshrined in the provisions of the Magna Carta for women. You know, cultural practices like marrying these women at a very early age is a no-no in that Magna Carta for women. And protection of the child, laws on the protection of the child. So I think you just have to know the law and implement the law. It is already there in the Bill of Rights. Your right as a woman is already there. You just have to disseminate that to the ground and let both women and men to see the provisions. So that, for example, you enter a party and they will not accept you. If you want to go into politics, you enter a party and they will not accept you because you're a woman. Then you can maybe file a case in court because that's the law. They should accept you. Okay.
So we have to know our rights, no?
Yes.
Through these laws. Miss Noemi, have you encountered women in your movement or in the course of your activities in the movement of such kind of women?
Very few, actually. Very few.
Powered na sila.
Yeah, I think it has something to do, the cultural bias against women has something to do also with the generations. So probably that's an old practice, an old view about men and women, right? But probably to reinforce this gender parity and equal opportunity among women, it would be good if it can be introduced again in the curriculum. So again, education. So the boys should be educated about the women's rights, and girls also, probably a simpler version of the Magna Carta should be introduced in the curriculum as early as grade school. And that should probably progress to a more comprehensive content as they mature or as they pursue higher studies.
Yeah, so it really is, no, the facets of women empowerment are all intertwined, from the family to the education to the resources, and so but everything starts with the self. That's one of the takes I got now, no. So perhaps our one last few words from all of you. Let's start with Doktora San Juan to our words for our audience.
Yes, we have to realize that we have equal rights as men, so that we can also effect change by empowering ourselves, by educating ourselves, by going into women's groups that advocate against discrimination and gender equality, and also be in a position to effect change. You can be in that organization, but if you're not in the top positions or in Congress, you cannot enable the laws, then it will always be a problem. But now it's just a matter of implementing the laws from the national level into the local government units, so that it is important now to empower women, to monitor whether the local government units or the national government, national agencies of the executive branch are following the provisions of the Bill of Rights for women. That way, women can be empowered.
Yeah, thank you very much, Dr. San Juan. Chancellor Padilla?
I just want to maybe inform the audience that empowerment is a beautiful journey. And I think it's time to do some reflection, to know at which level of empowerment you are. If you're in the lower level, then maybe it's time to talk to other people so that you can start the journey of empowerment. And then if ever you're already in the top of the ladder of being an empowered woman, then it's time to mentor the younger generation. So I'm opening myself to the younger CISs who want to have an opportunity of maybe a lighter conversation, but I have many stories to share so that you can be the ones who will replace us in the university.
Yes, thank you very much, Chancellor Padilla. And last words from Ms. Noemi, Azura?
Yeah, we all women, we should help each other. So to all the empowered women and to all women in position, we should do our best to help other women and to lift up other women towards empowerment.
Yeah, so empowered women empower other women also. I think that's one thing also. So thank you very much, Dr. Filomena San Juan, Chancellor Carmencita Padilla, and Ms. Noemi Azura. That was an empowering afternoon. Thank you very much. We, the MU webinar team of the Mu Sigma Phi Medical Sorority, would like to express our gratitude to our partners, the UP College of Medicine, the Philippine General Hospital, and the City of Manila. This event would not also be possible without our co-presenters in Life Sheroes and the Mu Sigma Phi Foundation, and our official media partner, our Awesome Planet. We are also grateful for the unwavering support of UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. Again, we remind all healthcare professionals who are interested in obtaining CPD units to please fill out the evaluation form at tinyurl.com/MuWebinars2021 eval within 3 days after the forum. You may find the link to the evaluation forms at the comment boxes of FB Live, YouTube, and the chat box. We would also like to invite you to the next leg of the MUla kay Doktora Women's Health Forum on April 12, 2022, and we will be tackling a woman's vaccination tracker or bakuna para sa kababaihan, which aims to discuss the importance and benefits of immunization, particularly to the female population. The talk will also address the common myths on vaccination, discuss common vaccine preventable disease, and give us an overview on special vaccination requirements among pregnant women. And we have, for this talk, Dr. Regina Pascoberba, Dr. Sibyl Lisan Bravo, and our moderator, Dr. Angela Rodriguez Bandola. And likewise, please support and participate in our year-long Women's Health Forum series. Thank you very much and have a good day.
Thank you for attending the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum.
The MU webinar team of the Mu Sigma Phi Medical Sorority would like to thank our partners, the UP College of Medicine, Philippine General Hospital, and City of Manila. Again, the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum is co-presented by the In Life Sheroes and the Mu Sigma Phi Foundation. And this event is covered by our official media partner, our Awesome Planet. We are also grateful to the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. For those who are interested in obtaining CPD units, please fill out the evaluation form at tinyurl.com/MuWebinars2021 eval. Please ensure that your answers are submitted within 3 days after the webinar. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. For more details and updates, please check our Facebook page at facebook.com/MUwebinars and our Twitter timeline at twitter.com/MUwebinars. You may also email us at mewebinars2122@gmail.com. Before we end, we would like to invite you to the next leg of the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on April 12, 2022, Tuesday from 12 to 1 p.m. entitled A Woman's Vaccination Tracker or Bakuna para sa Kababaihan, which will focus on the benefits of immunization among the female population, the common myths of vaccination, the female-associated vaccine-preventable diseases, and the special vaccination requirement among pregnant women. For this webinar, we will have Dr. Regina Pascua Berba and Dr. Sibyl Lizan Reyes Bravo as our speakers, and it will be moderated by Dr. Maria Angela Rodriguez Bandola. And likewise, we would like to invite you to participate in our year-long Women's Health Forum series. Thank you very much for attending this webinar. Have a good day.